Hello guys, welcome and welcome to Meeting Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. Discussing the previous year question paper will always help you to solve the upcoming examinations. There are many number of upcoming examinations are there because many proposals are happened till now. For example, ESI, RRB, NORSET, more than you can expect 3,000 or 4,000 vacancy for nursing officers in this year. So it is up to you how you are going to prepare. The main way to prepare the examination is solving the questions. See, in Meeting Nursing Academy YouTube channel, there are many number of videos of previous year question papers and also the system-wise nursing questions solutions. So watch those videos also. In this session also we are going to discuss the previous year questions. Actually it is part 2. Part 1 of IGNO nursing question paper, that is solved question paper. It is already there in the Meeting Nursing Academy channel. Those who didn't see that video, please watch that video first, afterwards come to this video also. See, solving this kind of previous year question paper, it will be very much useful for the upcoming examination because we are not only solving the questions and also we are discussing the keywords from each and every questions, golden and additional points, and also the rationale behind each and every options. So watch the video till the end. Definitely it will be so much useful for you. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. See, already we completed 25 questions from this question paper, and the rest of the questions we are going to discuss today. That is, we are going to start from question number 25. Question number 26. Here the question is, the choice of educational media depends on all except. The choice of educational media depends on all except. Here the keyword is choice and educational media. There are many number of educational medias. Okay, the main purpose of the educational medias is to give the education, mass education or individual educations. Okay, so here they are specifically focusing on the choice. Why? What is the reason? What is necessary for the educational media? Okay, and here they are given 4 options, that is learning objective, gender of teacher, nature of group, availability of resources. 4 options they have given. Which one is suitable for the choice of educational media? Obviously learning objective is very important. Without objective we cannot go further. Without a goal we cannot go further. So learning objective is very important choice in education media. Gender of teacher. See, gender doesn't matter at all. Even male or female, whoever is willing or whoever is participating, we can give the education to them. Okay, so gender is not at all a matter. So we can consider the gender as a answer here. Okay, and the rest of the thing is nature of the group. If it is an individual group or a small group or a large group, whatever group it is, we can give the health education. And the last one is availability of the resources. Okay, based upon the availability of the resources we will select the group, right? Fine. So learning objective is also a choice of education media. Nature of group and availability of resources is also a choice of education media. But which is left? This is the except question. So which is left? Gender of teacher is left. So here the right answer is option B, that is gender of teacher. And the next one is, the characteristics of the good instructional aid include all except. Instructional aid means nothing but AV aids. A characteristics of good AV aids, audio visual aids, include all except. And they have given 4 options. Cost effective and cheap. Obviously a AV aid is there, means it should be cost effective and cheap so that it will be very much used. And second one is portable. Yes, definitely if it is portable one, we can carry anywhere and we can give health education to everyone, right? And purposeful. Yes, without any purpose, if you are handling a AV aid, means what is the reason behind that? No use at all, right? So it should be a cost effective one, cheap one, portable and purposeful one, right? And the last one is complex. The complex, if a AV aid is complex, the one who is handling the AV aid, it will be very difficult for them, and who is observing the health education or the AV aid, whatever you are using, it will be very difficult for them to understand the content whatever you are discussing from the complex AV aids. So This is also the except question, so we can go for what? Option D, that is AV8 should not be complex. Okay, and the next question is question number 28. Slide projector belongs to one of the following categories. Slide projector. There are different types of projector. Overhead projector, which we commonly seen in our college life. Our professors or lecturers or tutors are taking class by using the overhead projectors. They will be keeping a transparent film and the content will be written over the transparent film, and they will be projecting in the walls, right? So that is called as overhead projector. And the next one is slide projectors. Here they will be giving the slides. So this is also a visual projector. Overhead projector, slide projector, all are coming under what? Visual projectors. Okay, and the television or the computer with the speakers, it will be coming under what? Visual and auditory projector, because we can see as well as we can hear. And the radio, it is coming under what? Only the auditory projector. And the speakers, only speakers which is connected to the radios or which is connected to your mobile phone, it is coming under what? Auditory speakers. Okay, so here the question keyword in the question is slide projector belongs to which of the following categories, and they have given 4 options, that is projected auditory aids, projected visual aids, non-projected auditory aids, non-projected graphic aids. Okay, obviously slide projector is not a auditory one, so we can remove the auditory one. Non-projected, we are going to project the slide projector, so we can remove the non-projected things. So the left one is option B, that is projected visual aids is the correct answer. Option B is the right answer. Next one is question number 29. Very important questions. Frequently you can expect this kind of questions. The provision of temporary housing medical care occurs in one of these stages of the disaster management. Here the keyword is, 2 keywords are there. In case of disaster management, stages of disaster management, temporary housing and medical care. Temporary housing and medical care is done in which stage of disaster? And they have given 4 options, that is preparedness, response, recovery and mitigation. First, you should understand the stages of disaster. See, disaster means unfortunate things, that is happening or the most problematic thing, natural calamities which is happened to the peoples. For example, recently in Turkey also a big earthquake happens. Many of them are died. In hundreds of people are died in the Turkey, right? So it is an earthquake. Because of earthquake it happened. It is a natural calamities. Same like man-made calamities are also there. Okay, so a mass destruction or mass mishappenings are happening means that is called as what? Disaster. For that disaster, there is a stages of disaster and how we need to prepare ourselves in that stages of disaster, that is very important. There are 4 stages of disaster is there. The first one is mitigation. What is the first one? Mitigation. And second one is preparedness. Third one is response. Fourth one is recovery. Okay, so the first stage is mitigation. What is the meaning of mitigation? You are checking the risk. For example, you are living in one particular state. For example, like Turkey means, so how much chances are there for getting the earthquake in a year? Okay, so how much loss we can prevent? What are all the steps we can take in order to prevent the loss? Okay, so that is called as what? Mitigation, pre-planning. Okay, so this is coming under mitigation. And second one is preparedness. Preparedness means immediately you have to think about what? Training. So during the disaster, in order to handle that situation, you should have the training previously. For example, you can take a fire safety management. Suddenly there is a fire happening in a hospital or a building means the fireman will come immediately, because the fireman know how to manage that situation. So that is called as what? Preparedness. Already you are preparing, make a mock drill and you are preparing a group of people ready in order to handle that situation. That is called as what? Preparedness. And next one is response. Very, very important one, response. Once the disaster happened, immediately what you supposed to do, that is called as what? Response. Here activation of emergency protocol, because many people are under a problem, right? Many wound will be there, many death will be there. So to our handling the situation, emergency protocol has to be immediately alert. And the next one is medical assistance and first aids. medical assistance and first aid. So we are getting the medical care here. And the next one is shelter and evacuation. Temporary tenting will be done and evacuation of the victims from the situation is going to take place. Search and rescue, in order to in case of earthquake, buildings will be destroyed, so we have to search and rescue the victims. Okay, so these are all the things coming under what? Response. So sheltering is also coming here. So temporary housing and medical care is coming under what? Response. And recovery means again you are starting up, you are temporarily constructing the building and allotting the houses for the peoples. Okay, means temporarily you are again reconstructing the electrical work, reconstructing the buildings. So like that, temporarily again you are starting everything. That is called as what? Recovery. Okay, so these are all the 4 stages of disaster. The first one is mitigation, second one is preparedness, third one is response, fourth one is recovery. So in this question, 2 keywords are there, that is temporary housing and medical care. That's why we are going to the option what? B, that is response. Question number 30. The main reason for use of aspirin in the treatment of rheumatoid arthritis is. So here the keyword is use of aspirin in rheumatoid arthritis. To reduce the fever, to reduce the inflammation of the joint, help in range of motion activities, prevent the extension of the disease process. See, aspirin is a non-steroidal anti-inflammatory drug. From the word itself, you know it is an anti-inflammatory drug. So we can go to the answer option B, that is to reduce the inflammation, we are using the aspirin. And question number 31. Vitamin B6, it is also called as pyridoxine. Vitamin B6 therapy is important when patient is on one of these drugs, and they have given 4 drugs like kanamycin, ciprofloxacin, isoniazid, ethambutol. Okay, so vitamin B6 absorption will be interfere if you are taking a drug called as isoniazid. So whenever the patient is taking isoniazid, vitamin B6 therapy has to be given additionally. Okay, so vitamin B6 and isoniazid is related to each other. So here the right answer is option C. And question number 32. One among the following is the complication of spinal anesthesia. Spinal anesthesia. Here the keyword is complication of spinal anesthesia. Okay, let's search the complication. Hiccups, numbness of the legs, headache, no urge to void. See, complication of spinal anesthesia. The immediate complication of the spinal anesthesia is option C, that is headache. Why there is a headache? See, this is the spinal cord. This is the spinal cord, and this is the spinal fluid which is present or surrounding the spinal cord. You are giving the spinal anesthesia. So what will happen? You are puncturing here. So there is a changes in the pressure within the spinal cord and spinal fluid. So because of the sudden change in the pressure in the spinal cord and spinal fluid, what will happen? If there is any changes in the pressure, the first management for the first sign is going to be what? Headache. In case of increase in the intracranial pressure, what is the first sign? Headache. Same way here also, if you are injecting the spinal anesthesia, you are increasing the pressure of the spinal fluid. So again it will cause what? Headache. So that's why the complication of spinal anesthesia is headache. So here the right answer is option C. And the next one is question number 33. The most common site for cancer in the female reproductive system is. Here the keyword is cancer in the female reproductive system. Female reproductive system. And we have given 4 options, that is uterine cervix, uterine body, vagina, fallopian tube. See, this is the direct question, and here the right answer is uterine cervix. Uterine cervix is the most common site for cancer of female reproductive system. Okay, so right answer is option A. The next question is, a client with 30% of burns over her leg. When she comes to the emergency unit, your priority action is to. There is a 30% of burns over her leg. This is the key point, guys. Where is the burns in the legs? Okay, when she comes to the emergency unit, your priority action is, your priority action as a nurse, you have to clean the wound. The next option is perform endotracheal intubation, doing the head to toe assessment, start an IV line. Burns means immediately you have to think about what? Dehydration. Okay, so it first management, it should be about the dehydration. So cleaning the wound area, performing endotracheal tube intubation is not at all required here, because there is only burns in the legs, there is no burns in the upper chest or neck. Obviously we will be doing the dressing by cleaning the wound area, but that is not the priority one. Doing 8 to 2 assessment definitely we will be doing, but before that, what we supposed to do? We have to solve the dehydration. So here the right answer is option D, that is start an IV line. The next question is question number 35. All of the following are true about eczema except. Here the keyword is eczema. Eczema is also called as contact dermatitis. Contact dermatitis. The golden point here is, always remember, eczema is also known as contact dermatitis. That is the first point. And the second point is, it is often hereditary. It is often hereditary, means mostly it happens because of hereditary. It is a hereditary disorder. Understand? Fine. So here it is an except question. So let's see what are all the options given here. There is no cure. Obviously for eczema, you can give the steroids, it will get subside, again it will pop up, means come again. So there is no permanent cure for this. It is never hereditary. This is the wrong one, because often the eczema is hereditary only. It is a hereditary disorder only. Client must keep their fingernails short, because itching sensation will be there. The person will scratch. Once he is scratching, it will spread from here to there. So yeah, the person has to cut the nails, and steroids are always given in order to reduce the inflammatory reactions. So here the right answer is what? Option B, that is it is never hereditary. Okay, because it is an except question, so we are going for what? The wrong answer, that is it is the never hereditary. Question number 36. Which behavior by the patient indicates ineffective coping? Ineffective coping. The person is in stress and he is depressed and he is admitted in the hospital. Okay, and you are observing the patient. Which of the signs shows ineffective coping? That is the question here. And 4 options they have given here. Neglecting the personal grooming, looking at the old family photos. If you are stressed, means definitely you will be looking at the old family photos. Participating in senior citizen programs for the diversion. You are voluntarily participating in NGOs or other activities in order to divert yourself. Okay. Visit spouse graves once a month. Okay. Spouse graves. Graves means graveyard, the death area where the last ceremonies of the dead peoples are taking place. Okay. So visiting there once a month. Okay, fine. So if you are seeing, means all these 3 1 B, C and D are used for the effective coping, for diversion of the stress, management of the depression. We used to do this. But what about this one? Neglecting the personal grooming, means still the person is in depression and stress. He is not willing to come out of the depression. Okay, so this shows the person is in ineffective coping. That's why we selected option A. The next one is cardiac tamponade can cause one of the following. First, you should know what is cardiac tamponade. It is a accumulation of the fluid around the heart, that is in the pericardial space, and it is compressing the heart, and it is preventing the adequate preload and afterload, because there is a compression over the heart. That is called as what? Cardiac tamponade. So here 4 options they have given: spinal shock, cardiogenic shock, hypovolemic shock and anaphylactic shock. See, what is spinal shock? If there is an injury to the spinal cord, that time the spinal shock can happen. And what about cardiogenic shock? Decreased blood flow to the heart myocardium cells. It is called as what? Cardiogenic shock. Usually cardiogenic shock you can see in patient who is suffering from myocardial infarction or prince-metal angina or variant angina. Both are same. Prince-metal or variant angina, both are same, where there is a spasm of the coronary arteries. So decreased blood flow to the myocardium tissues. That is called as what? Cardiogenic shock. Even in cardiac tamponade, what is happening? Because of the fluid accumulation in the pericardial space, continuous compression over the heart is going to take place. So decrease in the blood supply to the myocardium, which leads to what? Cardiogenic shock. So on the whole, what I want to say is a cardiac tamponade will cause what? Cardiogenic shock. And the next option is hypovolemic shock. In case of bleeding, hemorrhage, that time we can see for what? Hypovolemic shock. Anaphylactic shock in case of any allergic reactions, drug allergic reactions. example. Okay, so that time histamine secretions is going to be there, dilatation of blood vessels are going to be there, hypotension will be there. So these are all the manifestations of what? Anaphylactic shock. So here for question number 37, the right answer is because of cardiac tamponade, the person will go for what? Cardiogenic shock. And the next one is rubella. Question number 38. Rubella is also known as you all know, rubella is another name of general measles. It is a direct question, and general measles is caused by rubella virus. Okay. Other important additional golden points are rubella, as I mentioned already, it is general. It is also called as German measles, and also it is called as 3 days measles. How many days measles? 3 days measles. Okay. You can expect questions like this also. 3 days measles is also called as what? The right answer is German measles or rubella. Other additional points are rubeola. What is that? Rubeola is also called as 10 days measles. Rubeola is also called as measles, and rubeola is also called as 10 days measles. Tetanus, as you all know, it is also called as lockjaw, caused by tetanus toxoid virus. And measles are caused by paramyxovirus family. Paramyxovirus. And whooping cough, it is also called as pertussis. Whooping cough is also called as pertussis, which is caused by Bordetella pertussis. So these are all the direct questions and key points you're supposed to remember always. These points has to be there in your fingertips. The next one is communicable disease having positive acid-fast bacilli test. A communicable disease. There are many number of communicable disease, right? Among those communicable disease, positive acid-fast bacilli test we will be doing for which communicable disease? This is the question. Here the key point is positive acid-fast bacilli test we are doing for which communicable disease, and they have given 4 options, that is poliomyelitis, tetanus, diphtheria, tetanus, leprosy, and tuberculosis and leprosy. For poliomyelitis and tetanus, we will not go for what? Acid-fast bacilli test. For diphtheria, SIC test we used to do. What test? SIC test. Okay, not this acid-fast bacilli test. Tetanus and leprosy, no. But leprosy and tuberculosis, we will be doing what? Acid-fast bacilli test. Okay, so here the right answer is option D. Question number 40. All of the following risk factor contribute for developing non-communicable disease except. Here the key word is the risk factor for developing non-communicable disease, and this is the except question. So you have to select the wrong answer. So 4 options they have given here. Risk factor for developing non-communicable disease except alcohol consumption, physical inactivity, assertiveness, hereditary. So the risk factor contribute for developing the non-communicable disease is hereditary, physical inactivity, and alcohol consumption. All these things are considered as a risk factor for developing the non-communicable disease. What are all the non-communicable disease? Cancer, cerebrovascular disease like stroke, respiratory disease like asthma, diabetes mellitus. These are all the things coming under what? Non-communicable disease. These non-communicable disease can arise because of severe alcohol consumption, physical inactivity, and hereditary, right? But what about the assertiveness? Assertiveness, it is totally not at all related to the question. Assertiveness means is more usually when you are performing or writing the curriculum vitae, that is your resume, we used to mention the word assertiveness. I am very assertive to the job roles, whatever you are providing to us. Means I will be so much clear and conscious about the work what I am doing. That is the meaning of assertiveness. Okay, fine. So here assertiveness is not at all related to this question. So we can go for what? Option D. The next one is question number 41. Most appropriate approach for prevention and control of cancer. Appropriate approach for prevention and control of cancer. This is a direct question, and here the right answer is option B, screening. Usually screening will be coming under what? Secondary prevention. There are 4 types of preventions. That is primordial prevention, primary prevention, secondary prevention, tertiary prevention. 4 types of preventions are there. Primordial prevention means we are preventing the development of the risk factors. These are all the golden points, whatever I am saying. Preventing the development of the risk factor, that is called as what? Primordial prevention. Once the risk factors develop and you are preventing the arising of the disease, once the risk factor is there but you are stopping the disease, that is called as what? Primary prevention. Secondary prevention means there is a disease and you are early identifying and preventing the progress of the disease, that is called as what? Secondary prevention. Tertiary prevention means minimizing the sufferings and pain. Okay, fine. So here the key word in this question is preventing and control of the cancer. Means already there is a cancer is diagnosed, and how you are going to control it? By means of screening. You are going to identify the cancer and you are going to control it. So here the right answer is option B. The next one is question number 42, that is Mission Indradhanush was launched to achieve. See, this question asked third time in the exams. Very important question. Okay, so Indradhanush, Mission Indradhanush, what is that? Whenever you are coming across the word Indradhanush, you have to think about the bow and arrow and rainbow colors. Bow and arrow, rainbow colors. Why? Let's see the rationale. Okay, and Mission Indradhanush was launched to achieve vaccine, 100% vaccine for the children. So option B is the right, option C is the right one. Okay, 100% vaccination of children. So here it is wrongly mentioned B. 100% vaccination for the children's. That is the main reason for Mission Indradhanush. Okay, and here the right answer is option C. Let's see the rationale. Mission Indradhanush was launched by Ministry of Health and Family Welfare. When it was launched, that is also important. Golden point, 25th December 2014. 25th December 2014, with the aim of expanding the immunization coverage to all the children across the India. Main one is immunization to all the children across the India, launched in 2014. Okay, and another important point is the Mission Indradhanush depicting the 7 colors of rainbow. Means they are focusing on 7 diseases. Same like 7 colors or in the rainbow, they are focusing what? 7 diseases. Okay, they are preventing the 7 diseases by the vaccination. This is the exact statement. Preventing the 7 diseases by vaccination. So what are all those 7 diseases? Diphtheria, pertussis, tetanus, TB, polio, hepatitis B and measles. These are all the 7 diseases. So Indradhanush, Mission Indradhanush means focusing on children's, especially the vaccination against the 7 diseases like diphtheria, pertussis, tetanus, TB, polio, hepatitis B and measles. Okay, so this is the golden points. And next is question number 43. National Program for Prevention and Control of Non-Communicable Disease include. Okay, National Program, NPC. In short, National Program for Prevention and Control of Non-Communicable Disease, we used to say it as NPCN. That is National Program for Prevention and Control of Communicable Disease. Okay, fine. So this is the direct question. When you are getting this kind of question, that is keywords for non-communicable disease, National Program for Prevention and Control, directly go for option A, that is cancer, DM, cardiovascular disease and stroke. These are all the non-communicable disease which is focused by the National Program for Prevention and Control. Okay, and question number 44, ratio of cardiac compression and artificial breathing is. See, here they are asking about what? CPR. Here CPR means immediately you have to think about what? Adult and children's. See, for adult, for 1 rescuer or 2 rescuer doesn't matter, the only ratio is 30:2. Okay, for children's it is not like that. For single rescuer 30:2. For 2 rescuer you can go for what? 15:2. For children, single rescuer 30:2. For 2 rescuer 15:2. But for adult, either single rescuer or double rescuer doesn't matter. You have to go for what? Only 30:2. Okay, but here they doesn't mention adult or children. Just they have given 4 options. Okay, and here 15:2 option is not there. Okay, and the next thing what you're supposed to think is 30:2. So here the right answer is 30:2. Option B is the right one. Additional points are, previously CPR means, still many students are making this mistake. They will be focusing on A, B, C. This is the previous one, but now it is totally changed. CPR means we have to focus on CAB. First, chest compression. Second one is airway. Third one is breathing. So this is the right one. Okay, for adult as well as for the children, CAB is the right one. CAB is the right one. Okay. Next question is permanent method of contraception. Very simple question. Many times they have asked these questions. Vasectomy and oral pills. Vasectomy is the permanent method but not the oral pills. Okay, so we can remove this option. Intrauterine device and oral pills. This is not the permanent method. Tubal ligation and vasectomy. Yes, obviously. Tubal ligation and vasectomy. Option C is the right one. And question number 46. All of the following are sexually transmitted disease except. So 4 options they have given here. The key point you have to focus in the question is sexually transmitted disease except. And 4 options they have given here: chlamydia, gonorrhea, hepatitis B, typhus. So chlamydia, which is caused by what? Chlamydia trachomatis. This is the additional point which I have added. Gonorrhea, which is caused by the Neisseria gonorrhea. Typhus is caused by the rickettsia. Okay, usually it is caused by the bacteria that are spread to the humans by fleas and lice. Fleas and lice. Typhus is the one. It is a bacterial infection which is spread by fleas and lice. Okay, guys, fine. So now you look into the answers, options. 4 options they have given here: chlamydia, gonorrhea, hepatitis B, typhus. And the question is, all of the following are sexually transmitted disease except. So chlamydia is a sexually transmitted disease because it is transmitted by the blood and body fluids. Gonorrhea is also the same thing. Hepatitis B is also the same thing. What is left? Typhus, because typhus is transmitted by the lice and fleas. Even though it is a bacterial infection, it is transmitted by the flies and fleas. Okay, so here the right answer is option D, that is typhus. Question number 57. All of the following are the job responsibilities of ASHA worker under NRHM, National Rural Health Mission, except. And they have given 4 options. See, ASHA. Usually one ASHA is used to cover the 1,000 population. This is the first golden point. One ASHA will cover 1,000 populations. First golden point. And second golden point is always the ASHA. Okay, they will be working under NRHM, National Rural Health Mission. Okay, fine. So what are all the roles and responsibilities of ASHA? There are many roles and responsibilities of ASHA. For example, health education about the nutrition, basic sanitation, healthy living and working condition, information on existing health services, birth preparedness, not delivery, only the preparedness. ASHA, they are not allowed for any deliveries, only preparedness. Importance of safe delivery, educating the importance of safe delivery, breastfeeding and complementary feeding, immunization, contraception, prevention of common infection, that is respiratory tract infection and sexually transmitted infection. So these are all the responsibilities of ASHA. Okay, and here conducting delivery is the extra point what they have given, and here the keyword is except. This is the except question. So ASHA, they are not allowed for conducting the delivery. So here the right answer is option D. Next question is, according to National Immunization Schedule, MMR vaccine is administered to the child at the age of. According to National Immunization Schedule, here you can see this is the National Immunization Schedule. Okay, so MMR, it is advisable at the time of 9 to 12 months. Advisable at the time of what? 9 to 12 months. Whether 9 to 12 months option is there here? No, there is no 9 to 12 months. So we can go to the nearby answer. Which is the nearby answer of 9 to 12? 12 to 13. So here which is the right answer? Option B is the right answer. Option B is the right answer. Next one is question number 49. One of the following is the viral disease: cholera, tuberculosis, TB, hepatitis. Cholera, it is caused by Vibrio cholerae. TB, it is Vibrio cholerae. Okay, it is a bacterial infection. Tuberculosis, it is caused by Mycobacterium tuberculi. It is also a bacterial disease. Typhoid, Salmonella typhi. Okay, and hepatitis is a viral disease. There are different types of hepatitis are there. Hepatitis A, B, C, D, E. Hepatitis A is also called as infectious hepatitis. Hepatitis B, C, D are spread by blood and body fluids. Hepatitis B, C, D. Hepatitis B, C, D is transmitted by the blood and body fluids. Hepatitis A and E is transmitted by the fecal-oral route, food and waterborne. Understand? Hepatitis A is also called as infectious hepatitis. These are all the golden points. Okay, fine. So here, which is the right answer? Which is the viral disease among these four? Hepatitis. Okay, so option D is the right one. And the last question what we are going to discuss today is very important question. Still many questions are asking in the exams and still many students are making the mistake because they don't know the three things. What is the three things? We will be discussing that. Listen here. Question number 50, that is pandemic of disease is known as pandemic. Corona is a pandemic disease. Right? Fine. So suddenly there is a chikungunya which is arising only in a particular state. That is called as in Kerala. So what is that? Whether it is a pandemic or endemic? It is an endemic. Only in particular region, particular peoples are getting that. Okay, fine. If there is a sudden increase in the number of cases and locally it is spreading, that is called as what? Epidemic. Okay, so the definitions are given here. Listen into it clearly. Endemic means constant presence of disease. Constant presence of disease in the particular region or a community without importation from outside. See, always there is a presence of disease in a particular region. Always there will be a presence of chikungunya in Kerala. Okay, this is an example I am giving. Fine. So that is called as what? Endemic. It is not coming from outside. Always there is a presence of this kind of disease. Endemic. Okay, so that is the keyword. And the next one is epidemic. Sudden increase in the number of cases of the disease above what is normally expected in the particular area. Always present is different. Suddenly there is a spikes, increasing in the spikes. That is called as what? Epidemic. Okay, pandemic means it is spreading all over the world. All over the world the peoples are getting affected. That is called as what? Pandemic. And the best example is COVID-19. Okay, based on all these things, let's see the options. Pandemic disease is known as spread of infection locally. Okay, spread of infection worldwide. Yes, obviously worldwide is called as what? Pandemic. Option C, existence of infection in a particular community. Always there is a presence of infection means it is called as what? Endemic. This is endemic. Okay, sudden spread of infection, sudden spikes of infection is there locally means this is epidemic. And option B is the right one, that is pandemic. Okay guys, so this is all about the previous year question papers. So if you have any doubts anywhere in this video, you can ask your doubts in the comment box. Okay, fine. So all the golden points, rational key points and the important things whatever you have discussed is very much useful for you for the upcoming examination. Please watch the video 1 or 2 times or 3 times so that it will be stored in your mind. If you are watching for one time, definitely it will not store in your mind. It is your life matters because the exams clearing is very important, right? So watch the video many times, share with your friends so that they will also get more knowledge and they will discuss the points along with you. You will get more and more intelligent IQ. Thank you very much guys.